Hello Albert, thank you for having me today, and might I say you look mighty fit. Well, as the name suggests, SEMWOS describes a child undergoing multi-level orthopedic procedures concerning hip contractures, knee contractures, and ankle contractures, or bone deformities. The difference being the child receives all these surgeries on each of these sites during one surgical procedure. Well, the child needs to only endure one hospital admission and, although very intensive, one rehabilitation stay. It replaces the old birthday syndrome, which was classically used to describe the constant surgeries performed each year in children with cerebral palsy. Well, the surgeries are used to correct muscle contractures, joint contractures, and bone deformities for a range of reasons, including gait, improving gait, and also just general gross motor functioning as well. But it also prevents further deterioration, increases participation in the community, and also improves the child's overall quality of life. Well, generally the patient will go through a three-dimensional gait analysis preoperatively to get a baseline measure of what their gait is like. Then they'll go through the surgery, which I won't dive into because it varies from child to child depending on what problems they have. And post-operatively, it just mainly involves physio. Well, in terms of physio, the post-op physio is the most important part of the whole procedure, and it begins after the cast is removed. Generally, my protocols include maintaining passive range, practice weight bearing, and hydro is highly recommended. Physio goes on for quite a long time. It can take them up to 6 to 12 months just to return to their previous level of mobility before the surgery happens. A colleague of mine, Contratect, in 2010, wrote an article on SEMWOS and physiotherapy interventions in order to achieve the greatest possible motor gains. I wish for all my patients to get the best possible outcomes, which will require a multidisciplinary focus, heavily involving on very intensive physiotherapy. It's a tough gig, but someone's got to do it. Cheers.